there, and welcome to Canceling COVID. I'm Tanya Rivens. I'm on the road, folks, but we're committed to bringing you this information and indeed keeping you informed and keeping you inspired. As we kick off this segment on this beautiful Tuesday, I want to say, first of all, thank you for continuously allowing me to be a part of your Tuesday as we bring you information to keep you informed, first and foremost, and to keep you aware so that you can make decisions that you should be making. Real talk, real solutions. It's Canceling COVID every Tuesday at 11 o'clock. As we start also, I'm traveling, but you have to wear many hats. And as you travel, make the adjustments, which is what I'm doing. And we're tweaking it. So, yeah, what you see behind me is like an office space that I had to take the time to borrow. I want to also, as we start out, say thank you, as always, to our sponsor. It is Groundwater Solutions. As you see me looking off to the side, Groundwater Solutions, groundwater-solutions.org, 704-596-0505, 704-596-0505. Now, I want to jump right in today because what I think is so important for you to know is all of this testing and booster shots and all the funding that has been provided, it's getting ready to stop. Yeah, it's getting ready to stop. It's an issue that I'm not sure if we hear enough about, but that's what we pride ourselves on, is bringing you that information so that you are aware. So the COVID-19 funding, federal funds have been depleted. And if you're uninsured, you're going to be challenged if you get COVID. And we need to talk more about that. And someone who's always out in the community, boots on the ground, letting us know what's really going to happen and what's our alternatives. I can never have this conversation, especially when it comes to our community, without bringing in my most supportive advocate in the community. She's out there working with you all and support Canceling COVID from day one. Still here with us is none other than Dr. Tracia Black. So first of all, Dr. Black, thank you and good morning. I'm seeing your mic is muted, so let me unmute it. It's the first thing that we need to do.
I think I get it. I got
There
it.
you go. All right. So good morning.
Good morning, beautiful. How are you?
I'm doing fantastic. It's always great to have you with your beautiful face as well. So, this issue right here is something that I'm not so sure we're hearing enough about, and we need to have a conversation about, is that the funds have been depleted and the uninsured, who's looking out, what are they going to do now that I believe the day is April 5th, that the federal funds will run out?
Well, I'll tell you this. March the 15th is when providers were notified that the funding, and we've been told for several months that funding was low, that eventually the funding for the uninsured would run out. There's a HRSA funds, HRSA. Those are that's the pot of funding that's been providing a lot of the resources for the communities across the country for COVID-19 support, treatment, if someone who was uninsured was hospitalized, for testing, and for vaccinations. And so on the 15th, we were told that the funding was running out and that you would no longer be paid for claims after, I believe, March 21st or 22nd.
Okay.
What happened was in our agency and laboratory, it kind of became this hurry up and get things in, because in order for a provider to be reimbursed for any type of COVID rate related things for uninsured, we have to submit information to the HRSA portal. And then HRSA will generate a temporary ID, which a medical ID for that particular patient. And then once you've been issued an ID, you can then submit a claim for reimbursement for whatever treatment or services that you provided. Well, our office staff was scrambling after the 15th, on the 16th, 17th, 18th, 19, trying to get patient information submitted to get that temporary ID before the 22nd so we could submit claims. Well, after the 15th, providers were no longer even issued temporary IDs. So they may be saying April 5th, the funding is running out, but they are no longer issuing even the information that we needed from March 15th to be able to submit claims. So we're not quite sure what's happening. We're not quite sure if that's going to be fixed so that even the claims through April could be reimbursed. So you got providers in a scramble, you got community members in a scramble who do still show up for testing, vaccination, and treatment. And we don't know if there's going to be resources to pay that.
So let's start. Let's kind of break this down and let's start. So with the funding gone, and let me just say, what I'm seeing is that Congress would have to request more money, and it looks like that funding may not be approved. But again, we're back to, if we didn't learn anything during COVID, let's start with people who are uninsured. If they don't have insurance because they cannot afford it,
Right.
what are they supposed to do?
I wish I had the answer to that. I think they're going to have to be agencies like ours that will step up and will still provide services. And that's just in the interim. I think the reality is that the United States government is going to have to find funding. There have been new budgets submitted that has continuation of funding for HRSA, the HRSA pot of money. However, and I don't know if you guys are aware, but that money that was allocated for HRSA has been sent to support Ukraine. So, is there money? There have been billions sent over there that was intended to go to the uninsured services.
So again, this whole uninsured, underserved population sounds like they're the ones that are going to be suffer the most. There was funding that was there that possibly was reallocated or redistributed to help with the refugees from Ukraine. But surely there has to be someone focusing. I mean, they got people in positions to focus on this. So one of the updates is that there's a fourth dose that has been introduced for the most vulnerable Americans if they want it, need it, rather, because I'm sure nobody really wants, it's out of need.
Right.
And that booster has been created for just those Americans. Reportedly, there's enough funding or enough doses available for that. But we've got possibly another variant on the way. I think you call it the Deltacron. How are we processing or even taking any steps? Or are you aware of anything that's being proactive once again?
Right now, there is no information, Tanya. There is no information. And in the healthcare community, we're saying what is going to happen. We know that Deltacron is coming. We know some say that it's already here. So we're asking, what is your guidance on how we who have to encounter folks who need the vaccine, who are sick and want to be tested? How are we to handle and support those individuals? And right now, there is nothing coming from the state or federal government on that. We are anticipating that something is going to come. It's going to come probably, maybe like God, always on time, maybe at the moment that we most need it, it will show up. But I would assume that there are folks on the federal and state level who are actively working on a solution. I just don't think they figured it out yet.
Well, I think what really disheartens me is too many times, and we saw this, it was politicized from the start. And although COVID could care less about any of the politics of it, I'm afraid that we're going to fall along those lines again as Congress goes back to request additional funding to help with the money that is now going to be depleted. And we've established, for anyone, I see some of you just hopping on, the uninsured, underserved are the ones who are going to suffer the most. So right now, is this a sustainable plan where the uninsured, underserved, if they don't have insurance, they go to these free clinics? Is it possible, like what you all also provide, that will be the only method that they will have as an option for getting treated for these COVID variants?
Well, I think that will be the only option, but there also has to be funding allocated for these clinics. And right now, even the clinics don't know where their funding is coming from. So we anticipate that there will be some funding that will roll out to the clinics that serve the underserved. We just don't know yet. And then part of the challenge, you are aware that we've traveled around to communities, rural communities in North Carolina who have not had access to vaccines and testing. And so the clinics that are out here are in more of the metropolitan urban areas. So what's going to happen to those folks who can't get to the clinics, so we're
Right.
going to have to utilize the strategies that were most successful during the height of the pandemics. There has to be mobile units and mobile
Mhm.
pop-up clinics out there, or we're going to see some, a recline in where we've gotten. And I don't want us to lose the momentum that we've already been able to achieve.
And we've made so much progress. I mean, we've got the new norm happening right now, and
Hmm.
everyone's kind of reaping the benefits of it.
Hmm.
But my goodness, as we know what we're faced with, it would seem to me that we would be more proactive and start preparing for, because all I see or hear now in my head is once we have another strain that's to the point where people cannot get the treatment that they deserve in
Hmm.
a timely manner, we're going to see some more deaths start to occur. And,
Absolutely. And
we
we
have
don't want to put our hospitals back in that situation again,
absolutely.
because that's going to take, we all know preventative care is more affordable, it's more successful than trying to treat once folks potentially have the COVID-19 virus. The funding will have to go to the hospitals, and it'll be way more than it would cost to keep testing and vaccination going.
Well, you mentioned earlier that you all are still starting to see, or you're still seeing people. So kind of give us a snapshot of how are things going with you all today as far as the amount of people that are coming through for testing and vaccines and so on.
I would say, we're still at about 20 people, maybe a day, 20, 30 people getting tested or vaccinated who are coming into our clinics. We are seeing low numbers of COVID-19, but they are present. We went through a period in February where literally for more than 1 week, the numbers were at zero. So
Oh,
they are no longer at zero. The numbers, daily, we're typically having some positives, but they're not at the extent. We are hearing those labs who do more, and every lab is low. The numbers are low compared to where we were at the heights of the pandemic.
uh-huh.
But we're anticipating the numbers going up. I was talking when I initially logged on. I was talking to a person who also has a state contract to do very similar things to what we do, and she said what she's seeing in her medical services, that the Deltacron is here. I don't know if that is true or not, but she's seeing her numbers go up. Our goal is to be prepared either way, to have the resources here, to be able to have the staff here, and for businesses that look like me, typically we're going to provide the service whether there's funding or not, but then do we want to put ourselves in a financial bind to make sure that our community is taken care of? Is that fair for us when you have other entities who have lots of financial resources who will not do the same? So my challenge is to the other providers is do not stop providing what's needed for this community. Join us in that effort to make the sacrifice to serve people so that we all live.
Well, you mentioned the Delta Cron, and that would be my next question is that's the next variant that we're expecting.
Mhm.
In talking with your colleagues, a little more easily spread than the previous one,
Mhm.
Omicron, and
Mhm.
what are like symptoms very much the same or
Mhm.
and
So
possibly less
yeah.
deadly?
Omicron spread so incredibly rapidly. And we use the analogy that if you're in a room and it's a room of 40 people and one person had the Omicron variant, that it was very likely, and we were seeing that all 40 people, even just being in the same room, would have Omicron.
Wow.
Well, they're saying that the Deltacron is even more contagious than that. I can't imagine what that looks like.
Yeah.
But, if it is, then we need to be concerned. We are not yet, we don't know how serious it's going to be. We are anticipating that our bodies have developed some immunity. There's some herd immunity out there that it will not have the same negative impact. But again, we still have folks who are unvaccinated. So if it's spreading, then there are folks who are at risk. And we know that the vaccine, although it is great for preventing serious illnesses, why take the risk if we can help control the spread? And testing, we know, controls the spread. Masking controls the spread. Social distancing and not having the congregate settings, we still need to keep doing the things that we know works.
Well, I was looking at the numbers just to verify. It showed that at least 20% of, and you could possibly verify this as well, at least 20% of the adult population, they haven't bothered to do anything
Mhm,
to try to prepare themselves as far as a vaccine or
mhm,
boosters. And maybe they're masking and doing the other traditional way or some natural
mhm,
type of methods. But to your point, people that aren't trying to take any steps for protection, we're just setting ourselves up for failure. And anybody just hopping on, we're talking about the federal funding ending on April 5th. And, the domino effect that we're going to have for that, if it stops on April 5th, we're going to be back behind the eight ball again, for lack of a better word, starting over again, because it
mhm,
takes a while to get these resources going, to get everything
mhm.
moving along. And we know right now, April 5th is next week.
Yes,
So it's not that far
a
off.
week from today.
Yeah,
Yeah.
I haven't heard much conversation about it. I haven't
Mhm,
heard anyone talking about how we're going to address this. And we know the underserved and uncovered are the ones who are going to bear the brunt. But let's also talk about people who have insurance.
mhm,
Um, who's to say that these insurance companies, they lost a lot having to
mhm,
do all these free testing and
mhm,
providing these vaccines. And I know they got some funding for it, but it
mhm,
still wasn't like
mhm.
what insurance would normally collect. Can we even
It
assume that they're going to cover it?
Exactly, that's my concern as well, because the private insurance companies follow the federal government. They will line their policies up, with, like, Medicare and Medicaid, and if the federal government is backing away from funding, then
Mhm.
it is very likely that they will follow suit. In fact, there were some concerns early in 2021 that even though the federal government was funding it, the insurance companies were so slammed with the amount of resources that was having to go for COVID testing and vaccines that we believe that they would move first and limit the amount of testing and vaccinations that they would provide. So we have not heard anything. They never did. But, is this going to be kind of a trickle down effect that impacts all of us? And so even those who are comfortable and say, well, I have insurance, that their insurance company is going to limit access to COVID related treatment.
So I've got Dr. Tracia Black of Groundwater Solutions on with me because I thought it was important that we just talk to her about what's happening, and because this is something that you need to know about as you hop on. Please share, let others know that we're having this conversation about the funding for COVID 19. The whole initiative ends on April 5th, the federal funding. As we talk about how this situation will be addressed, one of the things that I saw, and I didn't go over this with you prior, but I know that you again, have a great pulse on what's happening. This test to treat initiative that's now being looked at, which is do the free testing and then treat the person right there and kind of shift all these resources to private market. My first question, if it's test to treat, I thought that if you test it positive right away, the only treatment that you would be able to get would be antibody, because the vaccine you have to wait. And you can correct me if I'm wrong.
You're
The
correct.
other issue is how does it impact someone like you if they shift this all to the private market?
Hmm. Well, for us, I agree with the test to treat.
Mhm.
We've have doctors' offices because we never provided the monoclonal antibodies. That's
Okay.
probably something that we will have set up in our own offices. If
Okay.
not, and we are a firm believer that we don't have to be all things to all people. That
Right.
we can partner. Partnership and collaboration is key. So we do have folks that provide the monoclonal antibodies. You can drive up and get it. So I think as a private provider, we have to form the relationships or either pull in house the services that the community needs. I think it's more efficient. We know that it's more effective. When over the last 2 years, well, we only had the monoclonal antibodies about 8 months, but once a person tested, I mean, it really minimized the impact of COVID on their health. We were able to boost them with the antibodies to help get the virus out of your body quickly, which is the key to survival, is being able to manage and get it out of your body. So I think it's our responsibility to have what patients need when they arrive at our door.
But
And as
then
long as we have the support to get the resources, now it's impossible if you ask us to do a service or support and you don't give us the what we need to be able to provide that.
again, we're talking about federal funding for COVID. on the vaccines, the boosters, the testing. All of those resources are scheduled to run out on April 5th. Not to get anyone in panic, but the anticipation that there will be more, but also the preparation that you may just find yourself in a situation. Now, most people should have their take home or their home testing kits. If you haven't gotten them, ask around. Someone probably has a couple. Every household was able to get 4. I don't believe you can get any more now, the free ones. Perhaps that would be another solution. I recall seeing there was one additional weekend, one weekend only, that if you didn't get in during that open period, you could go back and
Mhm.
request for those COVID tests. But my question now too is, it's very likely people can find themselves on this test to treat initiative having to just scrape up money just for testing. Is that correct?
That is correct.
Wow.
Testing as well as the vaccine. If you're due boosters and you're uninsured, then you're going to have to scrape up the funding to get your booster shots.
That is really, really kind of something that people should start preparing for. I mean, a lot of people are still struggling to just pay their utilities, their rent. We've got skyrocketing prices for gas,
Oh my goodness.
food.
Mhm.
All of this is just a perfect storm starting to brew, and we're trying to get back to normal. My goodness, what do you
This
tell
is this
people?
is a terrible time for this. It just really is. And as a provider, where the people have asked, well, if the funding is not there, how much are you going to charge for testing, or how much for a booster or initial vaccine? The reality is we just don't know. Prior to now, even the medications, the vaccines have been provided to providers. We have not had to pay for the medication. So, again, that's a whole nother layer. If the funding is gone, what are we going to have to pay even to have the vaccines on hand? And we
So
don't
talk
know that answer.
So you talked about collaboration, which is good, but my heart drops though when I hear collaboration, because as someone who has a nonprofit as well, oftentimes the people that are grassroots, like yourself, that are in the community, that have the connection, when things shift to the private market, a lot of times you're left out.
Right. It
Does
goes
that
to larger providers who have a certain focus set or focus market that is not necessarily our community. It doesn't typically take place in our community. It's not necessarily within our churches. So that is a concerning factor. And I think for the government, it's easier to say, well, you know what? They have 10,000 patients,
uh-huh.
and it's easier. We can kill more birds with one stone, just give everything to them, but it doesn't take into account the grassroots organizations like ours that really get out and meet the people who won't go to that large facility.
And for the record, Moderna, who's one of the ones who are providing the vaccine, their company has already done an interview with Yahoo Finance and went public and said they're already shifting, working towards the private market enterprise
Mhm,
as far as this whole setup, which is really kind of disheartening to know that they're already shifting things in that direction. And we still haven't gotten out of the woods with all these weeds that keep
mhm,
packing up,
mhm,
popping up.
mhm,
So, what would you suggest right now for people, as we give them this information, which should be sobering on all
mhm,
points?
mhm,
If you don't have insurance, if you're uncovered and uninsured, as we see that the funding may potentially run out, and being that it's a week away, and I haven't heard a whole lot of
mhm,
conversation about it with our lawmakers, it's likely that it could and then get
mhm,
re-implemented, which means we have to ramp back
mhm.
up, which means it's going to take some
Exactly.
time. What
Yeah.
would you tell our viewers, our listeners, as they prepare for this and they can't afford insurance?
Right. I would say number one, get educated. So I thank you, Tanya, for bringing this issue to the forefront, because even as a provider, it's something we was sprung on us a couple of weeks ago.
Mhm.
We've been scrambling to try to figure this out, to at least recoup the funding that's there for the services that we've already provided. And then how do we plan ahead? So when you put that out there as the topic for the day, I'm like, wow, I hadn't even thought that the public may not be aware of this. So I think it's important for us to be educated. And number two, with any issue, our voice matters.
All right.
Call your elected officials, write, get some your neighbors, your family members, let them know what's going on. Because if we make a lot of noise now, it is very likely by next week funding will show up from
Yeah.
nowhere. Elected officials have a way when their constituency is making noise and saying this is an issue for me. They respond. They rise up and handle the things that are needed for our community. But if we are silent, and it can go under the radar, and April 6th will come and go, and then you'll be sometime in May needing a vaccine, or and you'll wonder what do you mean I have to pay for it? So we
Right.
need to make a lot of noise this week.
And just, I challenge you, please share this information as well, because to her point, it's election season. We've got primaries coming up in April, early voting that is coming up in April, the end of April, the primary in May. And we're inside of the election season, folks. And just as you hopped on and shared all of that information and weighed in about the Oscars the other night, how
Mhm.
about you hop on and share and talk about what we are facing as a country that has literally disrupted every aspect. No rock was, no stone unturned. Every aspect that you can imagine has impacted our lives. As we start to wrap things up, and again, I knew this would be a great conversation for a half hour as you weighed in, Dr. Black. I always appreciate you, of course, at Groundwater Solutions. Thank you for your support and for your sponsorship, and for always being willing to hop on and give the information that needs to be heard. Again, that's Groundwater Solutions, groundwater-solutions.org, 704-596-0505. As we start to wrap things up, could you also just kind of weigh in on where you guys are, what you're offering? I know you've got some great positions, opportunities available. I saw a job fair.
Mhm.
I'm not sure if that happened already, but please kind of bring us up to date with everything.
So the job fair is April the 6th,
Okay.
and we are really, really excited. We are located at 5104 Reagan Drive, Suite 5 in Charlotte, North Carolina. The job fair is from 10 to 3 p.m., I believe. If you have a question or need information, please call the number on the screen, 704-596-0505. We are literally hiring for almost all positions. We are healthcare, so clinicians, licensed substance abuse or mental health clinicians, qualified professionals if you have experience in the field. If you are a person in recovery from a mental health issue, depression, anxiety, worry, which we have all experienced at some point in our lives. We are hiring for peer supports. We're hiring for engagement, administrative staff, laboratory staff, medical assistants, nurses, you name it, we need you. We also are partnering with other businesses. We're partnering with Crustacean uh, Seafood Restaurant, a high-end restaurant downtown, and I think there are a couple of other organizations. And so even if you don't, I'm not interested in mental health, I don't want to be a server, we're having companies there who really just want to meet people to find out what your skills are, what are your gifts, what are you interested in. And if you're desiring a place to bring purpose and to really help, we'll find a place for you. So come out, show your interest, and we'd love to have you.
Oh, that's amazing. And as you were sharing that, are any of the positions that you have with you guys, are they remote?
They are remote. So most of our work is community based. That means that we're not a place, unless you're the administrative staff that you're coming in to answer the phone. We don't have a clock in and clock out kind of situation. You are assigned individuals that you work with and you support. And when you work and how you work, that's really up to you. We want you to meet the needs of the people. And if you never have to walk into our office, you don't have to.
Yeah, that's some great stuff. Great information. Groundwater-solutions.org, 704-596-0505. As we wrap things up here, we're getting ready to head out. Please kind of again, your take on this whole funding ending on April 5th, or anything else you would like to leave with our viewers and listeners.
Yeah, again, I just want to say make some noise this week, because if you think about it, the adults, a lot of the adult population is vaccinated. We are just kind of hitting the ground with our young people, so that this impacts them as well. Many of our young people have not had the opportunity to get their vaccines, first dose or second dose. Some who have the first dose are still waiting on the second dose, and with no funding, those things are not going to happen.
Yeah. Well, I tell you, we're going to do our part. We'll be back here again on next Tuesday. I want to say thank you and shout out to you for
Mhm.
supporting the workshop last week about this time. We
I
had to do.
enjoyed it. I really did.
Oh, well, thank you. I appreciate you. I mean, you just have this a beautiful heart to serve the community. So thank you for coming out. We did a conflict resolutions event with young people from Statesboro Elementary. Dr. Tracy Black served on the panel. And, I can never pay you for the support and the service that you continue to do in our community. So thank you again
Thank you.
for taking the time to join us.
Thank you for the opportunity.
Absolutely. So everyone, it's 11:30. Time for us to head out. We're going to stay with this, as you can see, totally committed to continuously bringing you this information. No intention of slowing down. We've got some other things, some big things starting to help as well that will also weigh in on that. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. I'll be back again next Tuesday at 11 o'clock. I'm still committed, and I still feel very much convinced. Someone asked me around the whole canceling COVID, is it around cancel culture where you cancel it, but you really don't? Yeah, how many times have we seen people canceled or things canceled and they come right back? But our goal still is to cancel COVID. And I know what you guys, we can. So I'll see you on Saturday, 10 a.m. on Praise 100.9 FM. I'll be listening for you, Sounds of Inspiration, as well as see you out and about in the community. Follow me on my social media handles, Tanya Rivens Live and the Tanya Rivens. But get out and enjoy yourselves. As always, thanks for tuning in. Thanks for your support. Please share and have a great day, everyone. Again, together, we are determined to cancel COVID. Take care, everyone.